Welcome to HR Voices, a podcast for independent HR and people professionals and the businesses they support. HR Voices is brought to you by the expert team at HR Independence Limited. We hope you enjoy.
Hello everyone, and welcome once again to HR Voices podcast. I'm your host, Mary Asante, and with me here today, I've got the incredible Magnus Kauders from Occupational Health Assessments. Hi, Magnus.
Mary, hi. Do you know what? When people say things like incredible, Magnus, it makes me sound a bit like a magician. I'm really not. I'm just a business professional that's got 20 odd years experience working in occupational medicine and a very obscure qualification in occupational health law. So I'll certainly be glad to guide you through as much as I possibly can on today's topic with the framework that I'm not medically qualified.
Excellent. You are great. And I think for anyone listening, and to put context to your background, Magnus, I believe sometimes you kind of undersell yourself a bit because you've actually founded and run occupational health assessments, haven't you?
Yeah, I have done. I have done. So, like many of our audience, I discovered that actually I'm far more comfortable working for myself than in big corporates, which I've done many times over my career as well. And I struck out in 2020, set up my own firm, and it has just grown and grown and grown since then. Sometimes I feel like we've created a bit of a monster. Very kind professional monster, but it's taken over more of my life than I ever expected, Mary. And I hope by doing what we're doing today, sharing knowledge and insights and best practice, we can help your wonderful members take that same journey so they can learn different skills and professional insights to guide their clients and grow their businesses. And I'm incredibly proud now. We're up to nearly 20 of us in the team. We've got nationwide coverage, and everything is set up so that HR professionals can get rapid access to insight and medical advice at the point of demand. But today is not about me selling outrageously our business. I do always give you a commitment, Mary. This is a no sales forum. What we're going to do today is just have a really open conversation around managing mental health and psychological ill health in the workplace so that your clients know some of the things that they can do quickly and easily whenever they're chatting with their clients and stumble across something that may have a psychological risk profile.
Excellent. Thank you, Magnus. And for anyone listening, I know terminology is a big thing, isn't it? And sometimes we always start off with the assumption that people know the terminology we're so used to using and not. And sometimes they do, other times they don't. But for the benefit of the doubt, what is the difference between mental health and psychological?
Yeah.
Yeah.
Yeah, you can have many different definitions depending on who you speak to. In our team, the clinicians usually use the reference psychological ill health to things which are more neuroses. So things that cause worries or concerns that can then manifest and affect somebody's health. So things like stress, anxiety, depression, they're really common workplace presenting factors that can either affect somebody's performance or even their attendance at work. Mental ill health we usually use in the context of things where they have become more chronic, long-term, profound, and usually where there's a diagnostic criteria sitting around like something like bipolar or psychosis, for example. There is a marked difference between a neuroses and a psychosis, and generally neuroses can be very well supported with talking therapies, with work as well, because work gives us structure and routine to our daily lives. So it's always helpful in any recovery. Sometimes they'll even get better without any medical intervention. It can just take a long, long time. They're what's called a self-limiting illness sometimes, but it can just take a long time for people to get better. Psychosis is where you might think the radiator is talking to you, and you're going to need a serious regime of pharmacological interventions and psychiatric support, sometimes under the care of a community mental health team, sometimes inpatient care. NHS support is variable, to say the least, depending on where you are in the country. Many of the businesses that we all support will have different infrastructure available, like employee assistance programs are very, very common. They absolutely have a value in a time and a place. EAPs are less good at dealing with seriously complex acute conditions, and they would absolutely say that. So, but all of them, any EAP, which is a phenomenal first line intervention, they will gladly just give some advice to even the manager who's just presenting and says, I've got this happening with an employee, what's the right thing to do? And they'll either say, great, refer through for 4, 6, 8 sessions of talking therapy, or actually this isn't the right intervention at the moment and this is the better pathway. Mary, I do need to say, if anything presents in the workplace which is that serious, an HR professional or a manager is thinking, oh my God, what do we do? This is serious. Occupational health are not the people to call. And that's not because we don't want to help, we always will. But occupational health is not there to provide a treatment service or acute response. So if somebody is that unwell, potentially that they're making references to suicidal ideation or any potential harm to themselves or others, we would always say just call either NHS 111, who are set up to provide support in these circumstances, or just call the ambulance service via 999. That is always the first line response for serious presenting conditions. If anything is lower acuity, by which I mean it's somebody's having blow-ups in the office, for example, and maybe is incredibly emotional, maybe has said something outrageous to somebody. These are very common circumstances in the workplace, or maybe has just started having a bit of Monday, Friday syndrome sneaking in. That is where occupational health is much more suited. But again, it's not going to provide treatment or diagnosis. We can't prescribe drugs to anybody. We can't make a referral generally. It does happen rarely, but we can't make a referral and say, actually, we know an amazing clinical psychologist and we're going to send you off to see him. And that's not because we're trying to be restrictive. It is just because occupational health cannot take responsibility for somebody's care. And if you write a prescription or a referral, you are taking responsibility for somebody's care, because we can't then independently advise on that care. And that matters because, as I'm sure your audience know, if you've ever tried to write to a GP to get medical information and it falls through the Access to Medical Reports Act 1988 framework, yawn. If you're ever having trouble sleeping, just Google it. It will knock you out in no time at all. But those sorts of things, to get information and advice back about helping somebody, if you go through the AMRA framework, it's really quite torturous sometimes. But that doesn't apply to occupational health, so which is why we don't take responsibility for somebody's care.
Yeah, and I think the distinction is quite important. And you have covered quite a number of things there, Magnus, from when it's a critical condition, then please call the professionals, call 111, 999, depending on their circumstances, etc., to look after the well-being of your colleague or workplace friend or employee. And that is quite important. And if you are dealing with issues such as workplace stress, long-term sickness absence, etc., to do with things that are not critical to the person's health, that is when occupational health can come in. And now I think someone listening to go, okay, if I'm dealing with someone that critical, when do I call in occupational health? Or do I not call occupational health at all? And I think that distinction is quite important.
Yeah, it is. It is. You're absolutely right, Mary. We would always say the first time you have an inkling that something is wrong with a colleague or that something isn't right in one of your client sites, the first thing to do is put your metaphorical arm around your client and say, what can we do to help? And speaking to somebody is better than speaking with nobody and maybe hoping the issue or the problem will go away. Most occupational health providers, we certainly are more than comfortable just answering a quick phone call. And part of the support we'll always provide for your community, Mary, is they've got to phone a friend. So if they just want to say, look, this is the scenario, this is what's happening, we will gladly just talk them through. These are the different options. There's no fee that comes with that. We would always rather do that and make sure that an intervention is being made appropriately, and then take on something that's just not right. And that's clinically led. It's not somebody who's going to speak to me or one of our management team. It's really important to say, make the most of the facilities your clients have. If they have mental health first aiders, absolutely great. We would say use them as much as you can. There was a it's quite obscure, but I've built a career in dealing with obscure things, Mary. There's something in healthcare called Cochrane studies. Google it again, they're really interesting. COCRHANE, and they are there to provide independent validations of whether something is a good idea or not in healthcare. So they generally would say, is a diagnostic scan actually worth doing? It's all evidence based, and a Cochrane study was done last year about mental health first aid training. And just sharing this because it is relevant to the audience. And there is no robust medical information that shows that mental health first aid training actually makes a positive difference. And an awful lot of people in the wonderful world of well-being went, oh, we're up in arms about this, you shouldn't be doing it. I actually have a different view. Just because there is no a paucity of medical data which shows this makes a positive difference, the corollary of that is there is nothing to show that it does any harm or doesn't make a positive difference. So I think whilst in some medical circles the jury is distinctly out on mental health first aid training, I fall firmly in the camp of it cannot be proved to do any harm. It is better than doing nothing, because when we are supporting human beings, as your members always are, Mary, it is better to put your metaphorical arm around somebody and say, are you okay, than not. So use interventions, get to know your clients, ask your clients, have you got EAPs? Have you got mental health first aid training? There are commercial opportunities for your members there to talk about training and development support, because we would really strongly advocate that things like mental health first aid training or the management of people with psychological ill health, they are essential line management skills, because the line managers are there, the eyes and ears of the business. And I know your members will put a lot of effort into talking to their clients about communication skills, recruitment skills, appraisal skills, coaching skills. But managers need to understand about things like mental health and dealing with stress in the workplace, for example. I am absolutely not trying to sell our wares, Mary. There are so many free resources which are phenomenally helpful for any business professional in just this area. So if any of your clients say we have an issue with somebody, or we think we might have an issue with somebody, we would always say, direct your clients towards the free resources that are available. The HSE website, which is one of the dullest websites you could ever visit, it is not set up to be riveting or engaging in any way, shape, or form, but it has so many free resources for businesses about things like stress and managing stress in the workplace. They are now, believe it or not, dragging themselves into the modern age and saying, rather than just making available this 48-page PDF guide, which we know nobody's ever going to read, they are now making video materials available as well, which are so much easier to use. There are two magic words to put into Google as well: working minds. Put working minds into Google, and you will find government funded learning materials, e-learning materials, posters, leaflets, guides. There is so much there for any business, freely available, to take them through the principles of, number one, identifying if you have psychological risks. Number two, how to intervene if you have psychological health risks. And number
Yeah.
three, how to manage things if something does present in the workplace. So these things, they can sometimes feel mysterious or difficult because particularly it's the second anything crops up in the workplace and it's health related, there is a tendency for people to drop it on HR and run
Absolutely. Yeah.
because it is difficult. But the more that collectively as a profession we can encourage line managers to take responsibility for what's happening, the
Yeah.
better the outcomes, the quicker you'll find things. Line managers are always going to be the ones who are closest to what potential adjustments might help. And the joys of making reasonable adjustments can sometimes be mystifying, but it doesn't have to be. And the more you can encourage your own clients to say, let's look at this. Have we got a problem? How do we know that if we've got a problem, we can do something about it effectively? And if something crops up in the future, what do we do about it? Those principles, there's so much there and it's all freely available. I would just like to, I feel like I'm talking at you without pausing
It's
for
all
breath
right. It's okay.
for ages. I do need to let you know as well. The HSE are now starting to make lots of noises about inspecting businesses to assess their psychological health risk management in exactly the same way they will assess the physical health environment. Now, as we all know, the HSE, and there are thousands of HSE inspectors in the UK, they absolutely have the legal right to walk into any business premises in the UK and conduct an inspection and audit of what may be happening. It is usually related to things like noise or pathogens like dust in the workplace. It's usually traditionally been much more industrial in nature, but that is changing, and they are openly saying they will start assessing businesses for psychological health risk management. If your client has more than 5 employees, they are legally obliged to do stress risk assessments in exactly the same way that they are legally obliged to do manual handling assessments, DSE assessments. And it is not a complex process. It really isn't. I mean, we get asked on a weekly basis, oh my God, stress risk assessment, can you do it for us? It is a really simple, straightforward process. Mary, there are so many free resources available again. Just Google HSE stress risk assessment. They have templates, they have guides, and it literally is. If you imagine walking around an office with a clipboard, shows how old I am. This is how I grew up in an office place. Walking around doing a physical risk assessment, you might walk around and go, that cable lying on the floor could be a hazard. What could we do about it? Well, we could tape it to the floor or we could run it round the side of the room. The principles of stress risk assessment are no different. It is literally sit down with somebody and say, what are the risks that you're facing across defined criteria, demands, controls, relationships, these sorts of things, and what's going to make a difference to help you stay well? And that is a step that every employer who has more than 5 employees should be taking. And I am absolutely sure we will start seeing in the HR press more businesses being taken to task.
And I think in addition to that, and in other to not to sound too regulation heavy in this conversation, there is, and it's been there for a long time, the management at work regulations,
Yeah,
which I'm mentioning because you talked about, okay, anything, whatever, will get dropped onto HR. But managers also need to recognize that they have got legal responsibility. Employers do have legal responsibility for the safety and well-being of their
yep,
employees in the workplace.
yes,
So that
absolutely.
it's not just physical health, it include mental and psychological health as well. So
Yes,
it's important to look at the total well-being of your employees. And actually, I was laughing because a lot of what you were saying brought me back to days when I used to do lots of management and leadership training around health and safety and all those sorts of things that I rarely talk about these days. But the bottom line in a workshop of people, overwork is as worrying as being underworked as well. When people have too little work to do in the workplace, they do worry because they start worrying about the safety, whether their work is secure, whether they're going to still be employed to pay a mortgage, to pay their bills, etc. And if they are overworked, obviously they can't cope with their workload, start to affect their health, their sleeping, etc. So as an employer, it's quite important to get that balance right and
Yep.
not wait for things to get out of hand before you start to address them. And so it is really important that employers take and managers take everything. Of course, that's not to say HR professionals don't have any responsibility, but their role is to support leaders and managers do their job well, right?
Absolutely. Support, inform, and guide. And I don't know, I have never met anybody, not a single HR professional, who went into the field going, do you know what, I'm going to do this because I just want to hire and fire people. Most people I've met go into it because they want to help people, they want to nurture and develop people. And you've got that balance of managing risk to the businesses that you're supporting as well, but it's an altruistic profession. And in the same way that people go into healthcare to try and help people. Now, some of the things that are going to matter on this topic for your clients are, you might have seen this case a couple of weeks ago, and if you put Jockey Club
Mm,
into Google and click news, it will come up. There was a marketing manager in the Jockey Club who has just been awarded £996,000
mm,
injury to feelings and compensation for unfair dismissal because he kept putting his hand up and saying, I am not coping. I am not coping. And his employer did three-fifths of nothing to help. And you can imagine the legal costs involved in that, let alone the financial costs and the reputational costs. And just to chuck a little bit more fuel on the fire, as if that wasn't enough, if the HSE come knocking, it is under the sphere of criminal law, not civil law. So, the difference there, the Equality Act, yes, disability discrimination comes with an uncapped liability. The average payout is now over 100 grand and the highest is 4.6 million, which is
mm.
staggering sums of money. But the psychological health piece under the management standards at work, that's criminal. The directors of the business technically can go to prison. I'm not aware of anybody having been sent to prison on this topic, but that doesn't mean I'm a director of
I,
my own business. I
I
don't want to
think
take that risk.
the point is if it gets to that,
Yeah.
then something has gone horribly
Oh,
wrong. And
drastically.
there are loads of opportunities within the workplace to
Yeah.
safeguard your employees, to safeguard your colleagues, your team, and yourself as a business leader before it really gets out of hand. Because more often than not, people will let you know, or you will see you will see observable changes in people when
Yep.
they are
Yep.
when they start from anything from becoming withdrawn to performance starting to drop to change in behavior. There is a whole lot of things that if you know your employees quite well, you can
Yep.
probably pick up the signs before it gets to, and yes, have a conversation with somebody, put an arm around somebody. And that is where I think a lot of the time people go, oh, HR is just so soft. And then it's just, yeah, people come to work not to be mollycoddled and all that.
Yep.
But at the end of the day, if you are empathetic, if you understand the team that you are actually leading and managing, there is a lot of opportunity to catch a lot of things, to address them, to support people. I think employers will go with checklist, right? We've come across all that again and again. Oh, we've got an EAP program in place, check. We've got a mental health first aider, check. We've got an HR person, blah, 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 check. We've got a manager who's been on half a day, 1 hour, 2 hours, half an hour, or an online training for this, check. It means that if you, and I think that is where the people might say, okay, HRC can come knocking, but honestly, if I can give them the checklist of things I've done, then I'm covered.
Yeah.
But the key is looking at the human aspect.
Yep. Mary, as everybody knows, we are all different. We're all different colors, shapes, sizes. But the one thing that we all have, some of us more refined than others, but we all have it, is intuition. And if your intuition tells you that something is not right with a human being in your workplace, it is better to say, just quietly, I'm concerned. Is there anything I can do to help? And a lot of people may well say, no, I'm fine. But you've done the right thing. It is better to ask than wait for something to blow up. This is an age-old phrase. Everybody knows it. Prevention is better than cure.
But it's also quite important, and you've touched on a key important thing, asking the question, are you okay? Are you all right? If it's not a culture, if it's not a
Yep.
workplace environment or a culture that supports people being able to say, I am not okay, then
Yep.
people's reaction will be, yeah, I'm fine. Yeah, nothing to see here. But if you've cultivated a culture where people can openly and safely discuss their psychological illnesses, then you would find that they will be proactive about, or even if they don't realize and they are not being proactive about it, if you are proactive and you ask them, they will say, yes, actually, I've been feeling low a lot lately. I've been struggling with my sleep. I've been this and I've been that. And then sometimes a conversation of, do you need to see a doctor? Have you considered the EAP program? Or
Yep.
is there anything that we can do to help? Is it work related? Because I find that a lot of employers leave the is it work related last or don't ask at all,
Yep.
because sometimes, oh, if it's work related, then what does it really mean? Oh, we've got
Yep.
liability and we've got this and we've got that. And so it's a complex thing. We are dealing with human beings and we are complex organisms, right? But there are
Absolutely.
several layers that we can take in a scaffolded approach to addressing issues of psychological illnesses and mental health in the workplace in a way that can become absolutely supportive and be create that psychological safety for people within the workplace.
There are so many areas of HR practice that overlap with healthcare, recruiting people who are fit for the roles that they're being brought in for, understanding how to support them physically and mentally, understanding how to intervene as and when, creating the right culture so that people can thrive in the workplace. There are so many areas that require consideration and planning by HR professionals. And that's the key. The more you plan for these sorts of things and think about them in advance, the easier you're going to make your own life and your client's life. The worst place to be is when you are reacting to something which has just exploded in the workplace and that you know nothing about. And I can absolutely bet probably half those conversations your members will have with their clients are with people who don't have a first clue about the joys and wonders of the Equality Act. They don't have the first clue about things like stress risk assessments. And they will probably be saying, well, they should just pull their socks up or move on because I've managed to get to where I am today without having these sorts of issues. And those are the realities of what your members deal with on a daily basis, I'm sure. Having conversations with people who just think this is the biggest, this is the shirkers charter, because those that don't want to work can just say, "Oh, I'm feeling a bit low," and then we'll readjust their work or their working patterns and responsibilities. I would challenge, and I know you have to be tactful and diplomatic constantly when you're dancing round the uninitiated managers who will want to throw hand grenades at you on a daily basis until the problem that they perceive has gone. I would say you just have to be resilient and consistent in telling them that they might view the world one way, but we all view the world through different eyes. And what you have to manage is not the line manager's perception of what's happening. You have to manage the reality of what you are facing. And if the reality of what you're facing is you have a team member who says, I'm really struggling or I can't do that, you just have to manage that. And it's always a business choice as to whether you say, we've adjusted the role or the environment and we can't do that anymore. So that's a capability dismissal. Those are management decisions, but the principles are inform and advise the uninitiated managers who will just want the problem to go away. The risks, human, legal, and financial, to not being sensitive with somebody who's in a difficult situation.
Yes, and that is again going through the right process and the right procedure. But to do that, you need to have the right process and the procedure in the first place. You need to have awareness in the workplace. You need to have policies in place to support that. And you also need to provide training, not just for your managers, but also for your employees as well. I think occasionally having a staff meeting and bringing somebody who is well versed in the area to talk about mental health awareness in the workplace, its impact, implications, the signs, the telltale signs, and all those things are all things that if you genuinely care about the mental well-being of your employees, you will go beyond the policy, the procedure, checklist, and whatever, and you would do more practical things to really help support. And actually, the one thing that is common these days is either remote working or hybrid working or all sorts of working arrangements in place, which really means that a lot more people are working in isolation.
Yeah, very much so. Probably, Mary, this is going to sound quite obscure, but indulge me because I'm going to take you on a little story for a moment. When I first started working in occupational medicine 20, 25 years ago, we always used to see 40% of a workload was psychological, stress, anxiety, depression. 40% was physical, work-related upper limb disorder, bad backs, carpal tunnel. And the other 20% was just what happens in life. People will get cancer, they will get heart disease, they will have neurological conditions. It's sad, but that's just the nature of life. Nowadays, 75% of what we do is psychological. And when we see the referrals, the instructions from HR professionals coming into the team, you can bet your life nowadays, 1 in 4 of those psychological presenting conditions will be people who are working remotely. That is just how it is nowadays. And a lot of it is hard. It's difficult. The only human contact you might get is when you nip out and say hello to the postie.
Yeah.
That's difficult. Not all of us like chatting as much as other people. Some of us are introverted, some of us are extroverted, but we are all social animals. And it is psychologically dangerous to be segregated from other human beings for an extended period of time.
Yeah.
Definitely. So
And that is the one of the things that, if nothing at all, I think our listeners must take from this, the importance of checking in on
yeah,
people who are working remotely and putting measures that work for your workplace and your working environment to make sure that every now and again, or as often as you can, you are checking in with your employees working remotely, you are checking in with your team members working
yeah,
remotely, and
yeah,
you are checking in with your teammates or workplace colleagues and friends working remotely. And that can also be quite difficult sometimes for people who are starting with an organization if they're working
yeah,
remotely because they don't know anyone within the organization. They don't know, they haven't got, or most people wouldn't have friends in the new workplace that they've moved to. So helping and supporting people right from the onset is very important
yeah,
to make sure that, okay, if we're all in the office and we're all heading at one point to the kitchen or canteen or cafeteria or whatever for tea, coffee, water, whatever, we may bump into people on the way and we may say hi, hello, and stuff for 30 seconds, 20 seconds, 1 minute. And sometimes it turns into, oh, let's go into that meeting room type of chat.
yeah,
Whilst if you're working remotely, a lot of the time, you're probably so focused that unless you have a meeting booked with somebody, you wouldn't just drop somebody a message to say, hey, how are you doing?
yeah,
Without probably sometimes the colleagues on the other side, and that can in itself become problematic sometimes, saying, why are they texting me? Why are they sending me a Teams message? Why are they doing this? Get on with your work. Let me do mine. And
yeah.
so that's a whole lot of opportunity around remote working that we can, and I believe it will get better and will evolve over a period of time, but it needs to be intentional, not just us sitting back and waiting for things to happen.
Yeah, Mary, as with many things in the professional field of HR, the worst thing you can do is leave something to be like a sheep dip process. We've made one phone call this week, tick, let's do it next week. The more natural and the more comfortable these sorts of interventions are to just put in a phone call, anything to keep in touch with people. We know it can be incredibly isolating being a single-handed HR consultant running their own practice, sometimes from a dining room, sometimes in partnership with another one or two people or some associates. It can be really isolating, and your members need to take care of their own psychological health. You are phenomenal in what you are doing, building this community. People have access to the Facebook groups, they have access to the meetings that you organize. If they haven't made the effort before to go to the annual conference, I'd say do it. Build yourself as part of a community of people who are facing the exact same challenges in life and work that you are. It is invaluable to have that kindred spirit somewhere nearby that you can just pick up and have a quick natter to if you want to. That's why
Absolutely.
we are such big supporters of what you've been doing over the last few
Oh,
years,
thank
Mary.
you. Thank you for your support, and we truly appreciate it. I can't express enough how supportive you and Occupational Health Assessment is being of HR independence, of HRI, and continue to be. And I think you have touched on a very important point, which is you cannot provide effective support to your clients, to your customers and everything when you are running on empty, right?
Yeah.
When you
Yeah.
are low and when you are not functioning properly.
Yeah.
So it's always important to look after yourself to the best of your abilities, and also to recognize that sometimes it's better to take a bit of your own medicine that you prescribe to people, right? So we
Yeah.
can go out and be telling our clients to be supporting them, to say, hey, reach out to people, hey, communicate with your employees, support, provide support in this, and work absolutely in isolation.
Yeah.
Because ultimately, yes, we are consultants, yes, we run our own businesses, but there are loads of opportunities through communities such as HRI and others out there for you to link up with other HR consultants, to link up with other HR professionals, and sometimes others outside your profession. I mean, when the COVID restrictions lifted, Magnus, I started Surrey networking,
Yeah.
and we meet at Epps and Downs once a month. And when we first started, we were meeting a lot more often, but we settled on the once a month when everything opened up again and people
Yeah.
started getting busy and stuff. And the whole idea was I found myself sat behind my computer for 17 hours straight because
Whoa.
during COVID, and HR was busy. We were
Yeah.
support. I mean, government Thursday evenings, first thing Monday morning, last thing Friday evening was when updates were coming that
Yeah.
you needed to get yourself up to speed, then support your clients to make sense out of it. There was furloughing, there was this, and there was a whole lot happening. And the moment I get up, either a phone call will come through or an email or something that kind of go, okay, let me deal with this first. And then the next thing you know, you've been sat behind your computer for hours on end. And that is not even adding in homeschooling and everything else. I'm talking purely
Yeah.
about work.
Yeah.
And I thought I must not be the only one in this situation. So I put a few feeders out there, and actually, the interest it generated on local Facebook groups, etc., was quite high. So I
Yeah.
thought, okay, let's meet up, go for a walk, get fresh air,
Yeah.
and then meet people and encourage people, etc. Apart from the networking opportunities that bring, it's also, I knew that if I committed to something like that, I will go
Yeah.
and
Mary.
I will make the time to go. Hence, Surrey Networking was born. Otherwise, it would be like, oh, okay, I've got this meeting with Magnus, then it overflows by 5 minutes. Oh, then my next meeting is coming up. Oh, I've got to respond to that email. And I have to do, and before I realize, there really isn't any opportunity to do anything else.
Mary, my wife quite often shares with me these words of advice, and it's I think it's meant positively. It's usually couched when I may have done something wrong, but be the change you want to see.
Absolutely.
And that genuinely resonates with me in
Absolutely.
work, in my personal life. I just try and model as much as I can about what I'm doing and saying in our workplace. It's just, yeah,
Anyway, thank you, Magnus, for joining us once again and for a very engaging conversation. And hopefully, it would help all our audience, but if not, I am hoping that it will help those who really need to hear this message, whether you sit in the seat of an employee, whether you are an employer, a workplace business leader, a manager, a team lead, an HR profession. I think we all have a responsibility for our own mental health and for that of our colleagues and friends around us.
absolutely.
So, thank you for joining us. If you've
Mary,
enjoyed,
It's a pleasure as always. There's very few people that will indulge me with a conversation for this amount of time. Generally, nobody wants to talk to me about the joys of health at work, but it's always I've always had an incredibly warm welcome from you, Mary, and it's very warmly received. Thank you.
You are always welcome, and it's such an important topic. And I absolutely hear and understand and can relate to, although one wants to talk about it. It's a bit like health and safety training, isn't it? It's like, it's funny because when I used to do health and safety training, guess what? I bribe people who came with donuts, cakes, cookies. That's the health and safety training. It's like, because it's important people hear it, but it's a very dry subject. Like, it's got legal aspects to it, it's got human aspects to it, it's got physical aspects, psychological aspects, and the whole environmental and a whole sort of things. And people find it dry, but it's very important. So thank you for breaking it down in a way that our audience can understand and can relate to. And thank you everyone also for tuning in and for listening to us. Until next time, we'll see you again soon. Thank you. Bye.
We hope you enjoyed this episode of HR Voices. If you have a topic you'd like us to cover or would like to be a guest, we'd love to hear from you. Connect with us on social media or email us at hrvoices@hrindependence.co.uk. Tune in next time.